Good morning, everyone. I'm Alan Larson, President and CEO of Sovah Health, and I'm excited to join our Chief Medical Officer, Sharanda Gunn-Nolan, who typically does these broadcasts. And I've been asked to talk specifically about emergency department diversion. A lot of people have been asking, mostly from the media, are you on diversion from your hospital? So I want to just kind of explain what diversion is and briefly explain why. So all hospitals from time to time go on emergency diversion. Major academic medical centers, community hospitals. It's a way to try to decompress when a whole bunch of people come to the emergency department at the same time. Sovah Health Danville and Martinsville both have used diversion over the last several weeks because of the challenges we have with limited staffing and high numbers of patients still using our services. We don't report those numbers because they change from hour to hour, and they will go on diversion and off diversion once we've been able to decompress. So we don't produce that information because it's not meant for the public, it's meant only for the EMS. The community, when you need care and seek care, should use the emergency department and not determine whether there's a diversion status to decide whether you should come to the hospital. If you're experiencing chest pain, if you're having stroke symptoms, if you have anything that causes you emergent need for health care, please come to the emergency department. We have the ability to prioritize and take care of those urgent needs as they come. So we are, as always, happy to be part of the healthcare solution for you and your needs in our community and achieving our mission of making our communities healthier. Sharanda, do you want to talk a little bit about COVID status and where we are these days?
Absolutely. So we'll start with some numbers. We have just under 30 patients across the market for Sovah Health Danville and Sovah Health Martinsville. And, about 80% of those are unvaccinated. I think that speaks to the necessity in getting that vaccine. The CDC recently published that 9 out of 10 COVID-19 deaths are prevented by a vaccine. So I stress it every time we do these videos, please get vaccinated. Something else that we do want to mention is every time you come to the hospital, we will ask your vaccine status. And similar to flu vaccine status and other immunizations, I just want to be really clear so that the public understands our necessity in getting this information is really, one, so that we can document it, but two, so that we understand your risk. It's not a means of judging what type of medical care you need or to single anybody out. And that's tasked, the healthcare workers and nurses at bedside are tasked with getting that information for medical reasons, just like we would ask your medical history. So I just want to make sure everyone understands that this does not change the care that we deliver. It's similar to any immunization record. It's simply your history and your information that we need. On that basis, we continue to recommend masking and good hand hygiene, social distancing. But that vaccine, we all want to gather this winter. We all want to be together, and we've missed so much through 2020. And as we continued into 2021, still with quarantine in effect, getting vaccinated and having your family vaccinated makes for small gatherings a lot safer and a lot less risky. So I would encourage everyone to do that as we approach quickly to the holiday season. Flu vaccines are out there. They have been deemed safe to be given in conjunction with the COVID-19 vaccine. Rest assured, flu has been deadly for quite some time. So we want to make sure everybody's getting those immunizations. Thank you.
One other thing that I would like to share, Dr. Gunn-Nolan and other leaders in the hospital have been very open and willing to come to your organization to talk about questions you might have about vaccine hesitancy. So as an organization leader, whether it's a church leader or community leader or business leader, if you have people in your organization that have hesitancy or questions about vaccine, that Sovah Health can be part of that education process, we're eager to do so. Please contact us so that we can arrange for a time in small groups or large groups to talk about how the vaccine works and reduce concerns and answer questions if you have them. We'd be eager to be part of a solution that will help us be able to help you. Thank you.